When I was speaking to Carrie Iron about this afternoon, she was saying that when Andreas Laupacis, when Craig Earle, when Walter Wodchus, and when Rick Glazier are speaking, they're really not speaking as individuals. They're speaking as participants in a group of research. So I know that we're going to hear all sorts of exciting research spoken by one, but actually collaborated by many. So with that, I'm going to call up Dr. Andreas Laupacis, who, as you know, is the Executive Director of the Li Ka-shing Knowledge Institute of St. Michael's Hospital and a professor in the Faculty of Medicine at the University of Toronto and one of the former CEOs of ISIS. So, Andreas, you are going to be speaking on drugs and diagnostics.
Thanks, Pat. So, I've chatted with a bunch of folks about this topic to get some input, including David Alter, Mohammed Mandani, Dave Yerlink, and John Yu at MAC. It's interesting to me that the two am I doing this or?
I don't know what's doing this, but that's interesting. I think it's data speaking to you.
Yeah.
Right.
Can people still hear me? Yeah, okay. So it's interesting to me that the two Ds, drugs and diagnostic tests, have been combined in one session because, to me, in some ways, they actually represent fairly stark contrasts about sort of past success at ISIS and hopefully future success at ISIS. I think ISIS research in drugs has been an undoubted success from many, many points of view. Academically, a huge number of publications in prominent journals. In the policy realm, there's a very close relationship between ISIS researchers and the entire drug program and colleagues across the country as part of the Drug Safety and Effectiveness Network. And actually, ISIS has had a big influence, I think, in the regulatory realm, with some research at ISIS contributing to decisions to take drugs off the market, like gadifloxacin, and to restricting the use of drugs such as rosiglitazone. So I think just like an undoubted success story. On the other hand, and it's kind of a downer to come to you on their 20th anniversary and say, on the other hand, although ISIS has been doing a lot of research regarding the appropriateness of diagnostic tests for many years. I mean, David Alter and the cardiac group have been looking at appropriateness of coronary angiography, echoes, etc. One of the first projects I was involved with when I became CEO of ISIS was a systematic review of PET scanning in the province. John Yu has done lots of work in the area of diagnostic tests. I would argue that very few of those studies have actually been published in prominent medical journals or, frankly, have had that much of an impact upon practice or policy. So it's, I think, kind of useful to kind of think about why the difference. And I think there's a number of reasons. So first of all, appropriateness. Although one can argue about the appropriateness of off-label use of various drugs, I think in general drugs are developed for certain indications. While, a CT scan or an MRI scan, the appropriateness of the indications for an MR or CT are virtually unlimitless. So it's easier to define, I think, appropriateness for the use of drugs than it is for diagnostic tests, which makes the results of appropriateness studies of drugs easier to interpret than those of diagnostic tests. Similarly, I think it's fairly straightforward, especially related to harm, to talk about the impact of drugs on outcomes. If your liver necrosis shortly after taking a drug, it's probably due to the drug. And similarly, some of the outcomes that are used in the studies of rosiglitazone or gadifloxacin, the relationship between the drug and the outcome is fairly clear. The relationship between a diagnostic test and an eventual outcome is much less clear because there are many other things that go between the test and the outcome. Then the third issue is databases. Although the drug databases aren't perfect, and it still is slightly depressing that in Ontario we don't have drug data for people younger than 65, the drug data at ISIS do get to us within a month of the prescription, and they're highly accurate. So, although we could complain, the drug databases are pretty good. Regarding diagnostic tests, though, we have no idea why they were ordered. We don't know what the results are. There are big gaps in the diagnostic test databases, and because they often come from CAI, we often get them sort of 18 months late, or sometimes get them 18 months later. So that's an issue. And then in terms of policy receptors, there was a discussion earlier today. There are clear policy receptors for the results of studies of drugs. For example, the Ontario Drug Benefit Program, Health Canada, makes it relatively easy for researchers to develop very close relationships that Jan was talking about with the policymakers or the regulators. On the other hand, I would argue that there's no obvious kind of one place to go in the ministry or even in the LIN or even in hospitals actually to say, hey, you're the person that's looking after diagnostic tests, let's sort of talk about that. So I think there's an issue around receptor, who the policy receptor of our research is. And here's a slightly controversial comment. I think actually clinicians and patients just are more interested in drugs than diagnostic tests. If you think about clinicians, I mean, many of us have relationships with the pharmaceutical industry. That's got both pros and cons. But there's a relatively clear relationship between when we give a drug and the outcome. On the other hand, many of us feel that there's a very fuzzy relationship between the diagnostic tests and the outcomes of our patients. Patients care about drugs because they're hopeful that they will benefit from the drugs and fearful that they'll be harmed by them. So they're very interested. By contrast, I think in general, patients view diagnostic tests as free, harmless, and always likely to give the right answer. And therefore, they aren't actually that interested in them. Now, I think some of the public discourse around mammography for low-risk women, PSA for low-risk men, may be starting to change that as people talk about the downstream negative impacts of some false positive tests. But I still think in general, it's a lot easier to get patients and the public interested in drugs than it is interested in diagnostic tests. I also think that actually journal editors and their readers appear to like studies of drugs and not be that enthusiastic about studies of diagnostic tests. And during my time at ISIS, I've been a co-author on a number of studies of drugs and diagnostic tests. And I actually went into the PubMed Citation Index the other day, and the drug paper that I was a co-author on from ISIS that had the most citations had 533 citations. That was David Yerlich and Mohammed Mamdani's study of spironolactone use after the study in the New England Journal showing that it improved mortality after heart failure. So that's 533 citations. The most highly cited study of diagnostic tests that I've been involved at ISIS had 10 citations. So that's a pretty, I think, one study was probably a bit better than the other, but I'm not sure it was sort of 50 times better. And I think it's just sort of an illustration that readers don't read studies of diagnostic tests as much, and they don't have the kind of impact, which actually then leads to what I think is an unfortunate thing, which is that I've been involved in actually with some junior scientists at ISIS, of saying to them, well, I know you're interested in diagnostic tests, but maybe you shouldn't actually get into it as a career, because it's going to be hard for you to get grants. It's hard for you to publish in high-impact journals. And I know there's a couple other people in this room that have said the same thing to some of these junior folks. And I actually think it was the right thing to advise them for their career. I think it was an unfortunate thing to advise them for the healthcare system. And so, to end on a sort of optimistic note regarding diagnostic tests, I do think actually that things are in the process of changing for the better. My sense of the rather messy battle between the OMA and the ministry right now is that a fair amount of it has to do with appropriateness. And a fair amount of that discussion around appropriateness has got to do with diagnostic tests, what the ministry's done with fee codes for echocardiography, et cetera. So I think this has actually the effect of elevating the importance of studies of diagnostic tests in both the political and policy realm. And I do think in the last few months, I've heard a lot more sort of high-powered people express interest in appropriateness of diagnostic imaging than they did before. And I think it's worthwhile looking to south of the border in the United States, where medical specialty societies like the American College of Cardiology and the American College of Radiology have become so concerned by what they view as the inappropriate use of diagnostic tests that they've launched, and this is important, in collaboration with Consumer Reports, a well-funded initiative that's aimed at the public, which is called Choosing Wisely. which is an attempt to educate the public about the questions to ask when certain diagnostic tests are being recommended to them. Now, I would argue, I think most people here would, David mentioned that in Ontario one finds that for some things in hospital care, more is better. And for sure, I think there is more inappropriate testing south of the border, but I have no doubt that we indulge in a fair amount of that up here as well. And it's interesting to me that Wendy Levinson, who's chair of the medicine, has recently started to engage her division chiefs in an exercise at U of T based on choosing wisely. And my hope is that that will sort of elevate the importance of diagnostic tests. And I actually hand it to our professional colleagues in the US for the American College of Cardiology, for example, to have the guts and the foresight actually to label this as an issue and try and do something about it. And maybe we can learn from that. I would also note that I'm aware of at least 2 or 3 radiologists who are getting training in health services research, which is, I think, a really good thing. In general, that's been a specialty that has not sort of embraced health services research and health technology assessment. So, to sum up, I do think we're at the cusp of an increase in interest in diagnostic tests by many groups, clinicians, patients, policymakers, politicians, and possibly granting agencies and journal editors. However, in order for those studies of diagnostics tests to have much of an impact, I do think actually we need to, and I know that David is working on this, find databases and get databases into ISIS that are much richer, containing the reasons for the ordering of the tests and the results, and timely. And my prediction would be, as we, actually I was here in the 10th anniversary, so I hope to be here at the 30th, that we can look back and sort of say that's actually the area of diagnostic testing. Appropriateness is an area that ISIS has really advanced, and actually our health system as a whole has advanced in the last 10 years. Thanks very much.